The news day continues here on One News Now. I'm Riza Diaz. Metro Manila has shown a slight upward trend in COVID-19 cases over the past week. OCTA Research Group says the reproduction number in the capital has increased to 1.13 and the average number of new daily cases went up by 16%. To help us make sense of these numbers, we have Professor Guido David of OCTA Research over the phone. Sir, good evening.
Yes, hi, good evening, Riza and One News.
Sir, OCTA reported that there is no significant movement even as the reproduction number in NCR has increased. Why is this?
Well, what we're saying is that the general trend is flat since October, and sometimes fluctuations do occur. And we don't want to be too alarmed when there is a slight increase in cases because, they offset each other. So there could be a slight increase and then a slight decrease. So we're only really looking at trends that are sustained, and those would be alarming, and especially when numbers increase dramatically. Now, having said that, we did notice 3 cities in Metro Manila where the numbers increased significantly. Although it's too early to tell right now if this is a serious a serious trend, or if it's just a byproduct of the recent Valentine's Day and Chinese New Year.
Sir, there is an increase in daily average of new infections, just like today. You said there's no reason to be alarmed.
Well, we're just saying that it's too early to tell. We're being scientific, and it's too early to tell if we should be really alarmed by this increase. We are, on the other hand, monitoring this closely, and we're looking at the data daily. And I would say it's slightly alarming, but it's not yet to the point that we should be completely alarmed and we should raise flags, etc., just like what we did in Cebu. So to compare, when we were seeing the increase in Cebu, we were watching it, but when we saw that the increase happened for 2 straight weeks, then we started raising alarm bells for the LGU and the province.
So you mentioned the celebration of Valentine's Day and Lunar New Year, but what are the other factors perhaps that are attributing to the increase of cases here in Metro Manila?
The other factor is actually the more concerning factor. If it's just the Valentine's Day or the Lunar New Year celebration, then it's really just a one-time celebration. So it's not really a sustained or a continuous trend in community transmission. What we are more concerned about is the possibility that the variant, whether it's the UK variant or the variant of interest or variant of concern that they have identified in Cebu, whether that is here and it is spreading. So that is a possibility because we have detected a few cases already in Metro Manila who carry the variant. So that is more concerning because if that takes hold in Metro Manila, it could have a really serious effect, just like what we're seeing in Cebu City. So in Cebu City, we know that the city is well managed. They have a scaled-up hospital system, contact tracing, etc. But they're still having difficulty lowering the number of cases or reducing the transmission. And if that takes hold, if that kind of variant takes hold in Metro Manila, we could have difficulties mitigating the spread of the virus.
Sir, how about the situation in Pasay City, which is now under the high-risk category? What are your thoughts?
Well, we read that there's a clustering of cases, and I think they had to lock down a barangay in Pasay City. So that is also concerning. That might be more concerning, in fact. But again, sometimes clustering of cases happen, and this happened, for example, in Pasay, in Iloilo, and also in Iloilo City. And in both of those cases, we were very careful before we raised the alarm bells. We even mentioned that we're monitoring them closely, and we, in fact, did not make the suggestion that the variant was there. I mean, we considered the possibility, but it was not really raised, unlike in Cebu and in Mountain Province, where they in fact identified the variant. So yes, Pasay is concerning right now, but we want to wait maybe one more week. We want to monitor the numbers even further to verify if the trend will be sustained.
A final question, sir. Do you already have projections in the case, or in case rather, the national government heeds the proposal of NCR mayors to shift to MGCQ?
Well, it's not an easy projection because the parameters may still change regarding the implementing guidelines for the MGCQ. What we're seeing right now is just close to the current trend. We're seeing about 570 to 580,000 cases total by the end of February, and we're going to make another projection for the end of March. But again, the projections will depend in part on the implementing guidelines, but we should have a more concrete projection by early next week.
Okay, thank you, sir. That was Professor Guido David from OCTA Research. The Health Department reports over 2,000 new COVID-19 infections, the first time in over a week. That brings the country's caseload to above 559,000, over 34,000 of which are still considered active. Nearly 95% are asymptomatic or mild cases. The virus has killed 239 more patients in the past 24 hours, pushing the death toll to over 12,000. Some 513,000, meanwhile, have gotten better from the disease, with 504 new recoveries reported today. Now, even as the expected arrival of vaccines in the country has been repeatedly pushed back, the Health Department assures the public that doses will be coming. Undersecretary Maria Rosario Vergere said they are targeting Pfizer and AstraZeneca doses from the COVAX facility to arrive in the country by March. But Vergere admitted that the delay is caused by the lack of indemnification law in the country. It would provide the firms with protection from possible liability, especially as the vaccines are still being developed. The DOH is negotiating with manufacturers if they can append documents such as waivers pending the passage of the law.
Kulang na lang po kasi dun sa COVAX facility is this approval or the agreement for indemnification. Wala na po tayong iba pang tinitignan na magiging balakid para ma-ship na yung commitment ng COVAX facility sa atin.
And we'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. The provincial government of Cebu has expressed concerns on how media outlets report the detection of COVID-19 mutations in the region. For details, Jenny Dongon is joining us over the phone. Jenny, good evening. What did local officials actually said?
Yes, Riza, good evening. Cebu Governor Gwen Garcia is calling on media personnel to use the right words to avoid causing panic. In a virtual presser, Garcia said they should be careful in using terms like Cebu variant when reporting. Earlier, DOH Region 7 spokesperson Dr. Mary Jane Loretti emphasized that the mutations are not identified as variants. The governor also told the public not to post and share unverified information on social media. Garcia was also dismayed by the recommendation of 3 consultant doctors to place the province under lockdown. She explained that the proposal is discriminative among Cebuanos as their mutations are yet to be studied. The National Central Visayas offices of the Health Department declined to heed the recommendation. Officials said the COVID-19 situation in Cebu province is still manageable as hospitals are not yet overwhelmed. Let's hear more from Governor Garcia.
Excuse me, we're taking good care of ourselves. Thank you. Kamaomi. We're managing. Thank you. In fairness to Secretary Duque, iyang gi-override ang recommendations aning tulo. And agreed because our Bernadas and particularly Dr. Loreche were both fighting for Cebu.
Risa, the Cebu LGU emphasizes that another lockdown will only cripple the local economy, which is still struggling from the impact of the pandemic. Cebu is expected to come up with an executive order dealing specifically with the protocols for accepting tourists coming from various areas, including Metro Manila. Risa.
Thank you for that update, Jenny Dongwon. Now, over in Israel, a bar is doubling as a COVID-19 vaccination hub, offering free drinks for those who are willing to be inoculated. Reuters reports that Tel Aviv's Genea Gastropub has partnered with the government to open its doors to vaccine recipients. The owner of the bar said the drinks that come with the shots are non-alcoholic as medical precaution. More than 43% of Israel's 9 million population have received at least one dose of vaccine from Pfizer. But officials are worrying that the turnout may eventually wane and hold back the country's plan to begin reopening the economy. Now, for more updates, visit News 5, the Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.